is Rachel, Core Medical Imaging, and I'm just going to give you a quick overview of the Canon CXDI software for the NE systems. You have these systems on both your portable and the new room in the health center. When you first turn on your machine, it will boot up to the login page that you see before you here. To log on, you need to click the down arrow and choose your name from the list. And then put your password in the box below using the on-screen keyboard. The password is case sensitive, so make sure when you set your password that you know whether or not you have the caps lock on. Once you enter the program, if you happen to come up on a page that looks like this with everyone's names, or it could possibly have another page open depending on who logged off last, just click the OK down in the corner, and that will take you to the part of the program where you will do most of your work. If you notice up in the left hand corner, we are on the exam tab and we are on the work list page. The past tab next to the exam tab will take you to the images that have been done already on this particular machine. Going back to the exam tab, again, there's our work list page here. To refresh your work list, the button on the lower left hand corner that says List Acquisition, if you click this, it will go out and refresh, and you will find any new patients showing up on your work list. If you need to change your search conditions for any reason, next to the list acquisition is the acquisition conditions. If you click this, it will give you the information of what you are querying for right now. Right now we're looking for all exams that are scheduled under the CR work list. If you need to narrow this down, you can take it to maybe 12 hours before and after now. If you would like to include other modalities such as your fluoro exams, you can click RF to add fluoro, and then you click List Acquisition. This will now bring up only the RF exams and CR exams that are scheduled before or after 12 hours from now. This can be helpful if you are going to follow up a fluoro case such as a small bowel with portable images, or you're going to follow it up in a different room than you started it in. This allows you to pull those exams onto this work list. The acquisition conditions will reset themselves to the normal, back to the normal default when you log out and someone else logs back in. Once you're ready to start your exam, you're going to highlight your patient's name. You'll notice if the exam code is entered into the computer, it will pull the needed views for you on the right hand side, and all you will need to do is click the Start Exam in the lower right hand corner. When you click Start Exam, the program will begin to get the detector ready for you. It will also talk to the generator and pull the generator information that you need. If for some reason the detector is not turned on or is not working, you will see this Not Ready or Detector Cannot Be Used message. Begin your patient. You need to refresh your list with the List Acquisition button. When you see your patient's name, you can highlight the name. If the exam code is loaded into the machine, it will load the exam for you, the views that you need based on your protocol. Sometimes you may come across an exam that is not entered into the machine, in which case it would remain blank. At that point, click Edit Exam. That will take you to the background where you can choose your category off the left hand side and load the views in you need from here just by clicking on the correct tab. Once you've got your exam the way you want it to be. You can click Start Exam. It's going to get the detector ready for you. You can see up here on the top line, right now we're still waiting for it to be ready. And now it's just turned into ready. It's ready for it to receive the exposure. Over here you will see the battery symbol letting you know that at this point you have 3 bars, so your battery is anywhere between 85 and 100% charged. This next icon here relates to the strength of the signal between the plate and the computer in the portable, and this icon here relates to the workspace that has been selected. On a portable you will only see this one icon because you only have one workspace. In a room-based system you may see a table icon or an upright icon in this corner. On this particular interface you will see that your technique is here in the upper right hand corner, and also after a certain amount of time your technique, your generator interface screen will show up over the top of the Canon screen. The eye in the upper right hand corner allows you to toggle back and forth between this, which I refer to as the Canon screen, and your generator interface screen, which is this. On the generator screen you can see that your KVP is set at 75 and your mass is at 20. This icon here means you are on the large focal. This icon is the small focal spot. You can choose your MA stations independently and your time independently, although for most of us it's easiest to click the mass and use your up-down arrows to change that from here. To change the KVP, highlight KVP, use the same arrows to go up or down from there. When you're ready for your exposure, you're going to rotor up, and these systems do prefer you to two-step the rotor. In other words, you're going to go halfway down with the rotor, wait for the ready tone, and then press the plunger all the way for your exposure. At this point I'm going to exit out of this exam and show you what the exposure will look like from a past patient. Once your picture comes up on the screen, you're going to see your toolbar fill in, allowing you to use the various tools. Starting from the top, we have rotate right and rotate left, flip left right, and flip top bottom. Anytime these tools have been used, you will see that they stay highlighted. So in other words, if I have something programmed to pre-flip for you, you will see that, for example, a PHS will come up already in reading orientation, and the flipped left right button will be highlighted, indicating that it has already been flipped to achieve that hanging state. This button here is a black-white invert. This can be useful in situations where doctors are trying to find the ends of lines or tubes. This next set of buttons here are your mag buttons. The hand tool allows you to pan the image if you need to see the corners, or if you need to see if you've got all your anatomy on. If you have any question about whether your picture is of good quality, if you magnify until the magnifying glass turns to a 1:1 ratio and then click the HQ, which is a high quality mag, that will give you the best indication of the quality of your image and what it's going to look like in packs. I do suggest when you're finished looking at that you use this button here, which is a reset or refit to the original size before you send that to packs. You can also use the the minus magnify to reset back to the original size. Click the OK when you're finished with these magnifying tools, and you will see that your toolbar lights up again. Lower down here you have your left and right markers. Once you've turned these markers on, they will always show up in the middle. You need to click on the screen or touch where you want that marker to show up. If you wish to move it again, re-highlight it so the red box is around it, then click where you want it to move to. If you need to delete it, just turn it off with the same button you turned it on with. This button here is ROI, which stands for Region of Interest. This is a reprocessing tool. What this allows you to do is to tell the computer, rather than analyzing the entire plate, you are going to indicate to the computer a square box, and it is only to use the pixels within that box for the algorithm. If you wish to make your overall image darker, you need to go over a more dense area of the image. If you need to make it lighter, go over a less dense area. Again, this is just a reprocessing tool. Hopefully you don't need to use this often, but it is one of the tools at your disposal. The only time you should not use this tool is on a chest x-ray. It can be used for any other body part, but not the chests. Once you've drawn your box, and again you need to touch opposite corners to draw a box. It doesn't matter which two corners, but they do need to be opposite. Once you've got that where you want it, you need to OK. If you need to fine-tune, you can use the select button. Each of these circles is a drag handle, allowing you to reset the size of the box. Once you are happy with the way it is processing, click OK to accept, or cancel to take it away. The next button here is your crop button. This is controlling the green box around the edge of your picture. Currently the computer is set to default to where it senses the edge of the exposed area to be. Sometimes it is set for the full field so that it is not in the way, as in this case for the cross table spine. But you'll find for the smaller extremities it should put a green box around just the area that's been exposed. If you need to adjust the green box, again, you're going to click the crop box, which will open this toolbar, cropping toolbar for you. Each circle again is a drag handle, allowing you to bring those sides of your image in. Again, everything that is within the green box goes to packs. If it is outside the green box, it will not go to packs. So you need to be careful you're not cutting off any markers or anatomy with your box. Over here inside the toolbox here you have your default button, which will bring the green bar into where the computer thinks the edge of the exposed area is. This tool here will take the green box to the full field of the detector. These boxes will scoot it in the direction indicated. They are very small adjustments. If you need to make small adjustments, I would recommend the boxes. If you need to make big adjustments, I would use the drag handles. The other thing, if you come off to the inside or outside of the green line, you will see a different looking icon, and this icon allows you to click and drag to form a new box, if you prefer that to sliding the lines. Once you're happy with where your green box is, you're going to use the close. And then if you need to mask in addition to your green box, you can click the mask tool here. This button in the upper left corner turns on and off the mask. With the mask on, you can see a dotted line along the edge here. that is the line of the mask. And you'll see at the top of the screen here it says click up to 12 points. So you can mask within your green line, and I'm double clicking at the end here. If you need to, click OK and you'll see the preview of where those mask lines will be. The mask can be handy if you have an incorrect marker or other anatomy you would like to mask out of the picture. You can do that. It can also be handy in the case of a marker being just outside the exposed area. You can move your green box out and then use the masking tool to create a space for your marker to be in the picture without sending a lot of the unexposed area into the PAX system. And if your marker was here, it would now be included in the image. The reject button here allows you to weed out which images you don't want to send to PAX. By selecting reject, it's going to ask you the reason for your rejection. Select that on the list and say OK. You will notice that now there's a red X over this particular image, indicating that it's been rejected and it's not going to go to PAX. Also note that the button that did say reject now says restore. If I would like to get that image back, I can click restore, and now the red X is gone, and I will be able to send that image to PAX. This button here is an undo button, and it will step me back 5 times, and then it'll gray out, meaning that either I'm on my own or I'm going to have to, no. If I click the toolbar tool 2 here, I do still have a reset button, and that reset button is going to take me back to the first thing that popped up 3 seconds after the exposure. So if you've made changes and want to undo all of them, go to this second toolbar and use that reset button to take away all those changes. This button allows you to make a copy of the image, which can be useful if you need to send the image processed in 2 different manners into the PAX. Maybe processed one way to bring out a line or a darker area of the anatomy, and once in the normal mode of processing. The info button at the bottom here adds and removes the typing around the edges. If that is in your way, you can click that button to remove that to see all the corners of the image. Used for this exposure, in addition to the time and date, over here in the lower right corner you can see the EI number, which is the exposure index for this individual exposure. Right underneath that is the exposure index target, or the ideal number that we are kind of shooting for. And underneath on this machine I have the Rex number also showing up. Rex number was used in the previous Canon systems and was included on this first system that we installed, just to give you a little familiarity. We are now switching over to using the EI, EIT, and a DI number, which is your deviation index, which gives you an idea of how far off of the target number you are. You can see now in the lower right hand corner I have added the deviation index number underneath the target number, and for this particular image our EI was 242 and our target was 200, so we are deviating by a positive 0.83, which in this case is close enough to call good. Anytime you get to a +3, you have used twice as much mass or technique as you needed, and a -3 would be about half of what you would have needed. If you see a DI around +1, you have about 15% more technique than you needed, and at -1, about 15% less technique than you needed. So you need to increase for any negative number. Negative numbers, again, so that means that you are underexposed. Positive numbers means you are overexposed. What you need to keep in mind is, what does the picture look like when you're determining when you need to retake an image. Images that are underexposed will be grainy and noisy. Pictures that are overexposed will actually be dark and have a lot of burnout in some of the less dense areas. These are the kind of things you need to keep in mind when deciding whether or not you need a repeat. Alright, now I'm going to go into some of the image processing capabilities of this software. When you first turn on the image processing down here at the bottom, you will get the level 1 processing, which basically gives you the ability to change the brightness and contrast. And you can see that the picture changes with me as I manipulate the numbers. But there's also a level 2 and again a level 3 within this system that gives you access to all of the processing parameters, including this top box here, which is anatomical part. And yes, it will make a difference whether you are on lateral or AP for some of the views. The LUT, this is your lookup table. So in your lookup table you have the curve that was used, and there are 4 basic curves in this system. And then you have your base brightness. Again, you can see the picture change as I make those changes. Base contrast. The brightness and contrast here are the ones that you saw on the level 1. And next down we have our edge enhancement. Now again, these are tools you should not need often, but they are in here if you need them. I have them set up based on the body part and projection that you've chosen. This dynamic range adjustment is what kind of gives a digital image its advantages over plain film. If I increase dark region enhancement, I am bringing back soft tissues or areas that are typically dark. If I enhance my bright region, I am seeing through areas that are typically bright. Like in this case, I'm going to see better through the L5S1 junction. If I take the bright region down, I'm getting less penetration through those areas. And with them balanced in the middle, I'm getting kind of the best of both worlds. And depending on the body part selected, you'll see that the dark region or bright region may change depending on what's selected. But again, hopefully that's not something you need a lot. Next is your noise reduction. If you have a picture that is underexposed and a little bit noisy, you may find that increasing this noise reduction will help smooth some of that out. Generally, again, it is set depending on the body part and projection, but on the occasion where it may be a little underexposed, that can be helpful. The grid suppression is on for any body parts that typically use a grid. If you, for some reason, do see grid lines on an image once it's in packs, it is possible that the grid suppression somehow got turned off. You want to make sure that this box is checked and you have the 52 line pairs per centimeter grid selected. There is a drop-down menu with many different grids listed. Yours, for the NE systems, it is always the 52 line per centimeter grid that you need to select. And this box needs to be checked for that to be on. Sharpness adjustment is again one of the digital enhancing effects. A sharp level that is off compared to the sharpness at 3. Depending on the body part, that may be utilized and it may not. The peripheral mask, again, is that mask that we were playing with our masking tool here, but it allows the system to put a mask around the exposed area so that you are not sending unexposed glare areas into the PAC system. That makes it difficult for the radiologist to read those images. If you do make a change in any of these processing levels, the picture or the computer, the system will make that adjustment for you. This Save as Default button at the bottom does not just save what you did. It resets the default settings. So if you do make a change in this level of processing, do not click the Save as Default. That's going to reset the system defaults, not save the changes you just made. So again, if you make a change in brightness or contrast or any of these settings, the system will make that change with you. There is no reason to click Save as Default. If you do, Calvin will probably be in to talk to you. So, to close this imaging processing box so that you can see what you're doing, just click the same button that you opened it up with, and it will close the box so you can see the rest of your images. One other tool I wish to show you in the measurement tools here is the angle measurement. This can be helpful if you're trying to figure out what angle to use for an outlet view. We're going to turn this on. First click is going to be at the inside corner of the edge of the scapula here. Take that line out to the middle of the humerus and then across parallel with the top and bottom of the film, and you should see the angle here is 9.32 degrees, telling you that approximately a 10-degree angle should work for a Y view. To erase that from the picture, just click on the lines again till you see the circles, and then use the delete button on the side. So again, turn on the angles, click the inside border, that would be the medial superior border first, and then the middle of the humerus, and then parallel out to the edge to get your measurements, highlight and delete to take it back off, and then just click measurement again to turn off the measurements. The annotation tool here, click what it is you need to put on the image. It's going to show up here. You can either drag it where it needs to go or just click where you would like it to be. To add something that is not on the list, click the Add Edit. Type in what you would like to put on, and you have two options. You can place and add it to the list, which means that it will be on the list for everyone else, or you can click Place Only, which will just put it on your image, and then you can click where you would like it to be. If you decide you've put the wrong thing on, again highlight and delete over here. You also have the ability to enlarge or reduce the size of the font in addition to deleting it. Alright, so if you need to resend an image to the PACS, if you need to make an adjustment to an image, you can go ahead from the pass list, bring your image up like we have here, make any of the changes that you need to make. If you need to add an annotation or change contrast, anything like that. When you have your picture set the way you would like it to be, click this tool up here. I like to think of it as a tool for sending. Click this here. It automatically comes up with PACS selected. If you are just sending one image, you would click the send image. If you need to send the whole exam again, go ahead and click send exam. Once you've made this choice, if you have made any changes, it will prompt you to save those changes before it sends them, in which case click OK, and it will resend that image into PACS. And you can see this flashing double arrow here, meaning that it's being sent right now. And now I'm going to go back to the list. This is our past list again. And going back to the exam tab here and our work list. If you have an occasion where a patient you're looking for is not on the work list and you need to take these images right away, you have the ability to use the emergency button here. Clicking that is going to name your patient emergency and give them a time and date based number. But it does allow you to go ahead and load views and get started with your images. So load in what you need to take, click Start Exam, and you're able to take the images. Once you've taken your image and you click the End Exam button, it will bring the work list back up again. So if your patient has been ordered in the time it took you to take your image, you're given the opportunity at the end of exam to attach that data before you send it. Now if you've started your patient and then you realize either before or after you've taken your image that you have the incorrect patient identification, you can click Suspend Exam and go back to your work list. You can see in this case I have a patient that has been suspended. When I re-highlight that patient, I have a new icon on the patient information pane. This icon would allow me to select a different patient from the work list and attach that information to this patient if I so choose. And now when I start this patient, he now has the correct name and patient identification. In order for that to work, there's a couple of things that have to be, a couple of caveats to that situation. The patient, you need to realize before you've sent it to PACS and suspend the exam. And then once in that suspended status, when you go to restart that patient, the patient's name you need to switch to needs to also be on the work list for that to work. If you've already sent it to PACS, then the correction of any patient data has to be done on the PACS side. It cannot be done on the modality.